The first step is to knock on your resident's door and to address them by their name and also introduce yourself. You also want to explain the procedure that you'll be performing on them today. Always protect your resident's privacy, so close the door or curtain, and always practice hand hygiene before touching your resident. Then you will lower the bed rail closest to you or the side you'll be performing the exercise on, and also lowering your resident into supine position. Then you'll obtain a blanket just to give your resident a little extra privacy and some little extra warmth when performing the range of motion exercises. Then you'll tell the resident which exercises they'll be performing. So the first exercise the resident will be performing are her neck exercises, and you see me explaining which exercises she'll be doing. Right now, the resident is performing flexion and extension exercises, which are repeated 3 times. Next are the hyperextension exercise, which is also repeated 3 times. Then the rotation exercise, which is performed 3 times as well. And finally, the lateral flexion exercise, which is again repeated 3 times. You also always want to ask your resident if they are feeling any pain or discomfort while doing their exercise, and to never let them overdo it. Next, you will uncover the right arm to perform the shoulder exercise, which start off with the flexion and extension exercise, which is again repeated 3 times. And then you perform your abduction and adduction exercises. And then finally, your internal and external rotation exercises, which again are performed 3 times, or repeated 3 times. Then ask your resident again if any pain or discomfort was felt. Next is your elbow exercise, which is just your flexion and extension exercises, again asking for any pain or discomfort being felt. Next is the forearm exercises, which are just your pronation and supination exercises. Again, repeated 3 times, and ask if any pain or discomfort is being felt. The next exercises are going to be for the wrist, which begin with flexion and extension once again, repeated 3 times. Next is the hyperextension exercise, repeated 3 times. And then your radial and ulnar flexion exercises, again repeated 3 times. The thumb exercises are next, starting with your abduction and adduction exercises, repeated 3 times, and then your opposition exercises. And finally, ending with your flexion and extension exercises. You always want to have your resident do as much as they can do on their own, or if they're nursing, or follow what the care plan says. Next are the finger exercises, starting with the abduction and adduction exercises. And then your flexion and extension exercises, repeated 3 times. Then you'll just cover up that right arm and then reveal the right leg to perform the next set of exercises, starting with the hip. Starting with the flexion and extension exercises, repeated 3 times each. Always asking if any pain or discomfort is being felt. Next are the abduction and adduction exercises. And then internal and external rotation exercises. Next exercise is on the knee. Just the flexion and extension exercises, repeated 3 times. You will next exercise the resident's ankle, starting with the dorsiflexion exercise, which is pointing your foot upward and pushing down on the heel. And then you also do your plantar flexion exercise as well, which is pointing your toes. And you repeat those exercises 3 times. Next exercises have to deal with the foot and are just your pronation and supination exercises. Again, repeated 3 times. And then finally, you exercise your toes, which start with your flexion and extension exercises, and then your abduction and adduction exercises. Then you cover your patient again, and then you will repeat this process exactly on the other side. Your first step after performing your exercises on the other side are to always provide comfort for your resident. Then you will remove the bath blanket from them, and then always place their call light back in reach. You will then lower the resident's bed to a more comfortable and safe level, or you'll just follow their care plan. You see me here, lowering the bed to a more comfortable position for the resident. Then you will follow the care plan to see whether the bed rails will be raised or lowered, and then you'll just fold the bath blanket back up and put it back to its proper place. You will also unscreen the patient and complete a safety check of the room. Then, always before you leave, you will always want to practice hand hygiene. And then you will report and record your observations and give it back to the nurse.